Sudogest Cold Allergy is a combination medication used to temporarily relieve symptoms caused by the common cold, flu, allergies, or other breathing illnesses such as sinusitis and bronchitis. Antihistamines help to relieve watery eyes, itchy eyes/nose/throat, runny nose, and sneezing, while decongestants help to relieve stuffy nose and ear congestion symptoms. If you are considering using this medication, carefully read the package instructions to ensure it is the right product for you. Some products may have similar brand names but different active ingredients with different uses, so it's important to ask your pharmacist if you have any questions about your product or its use. It's important to note that cough and cold products have not been shown to be safe or effective in children younger than 6 years, and some products are not recommended for use in children younger than 12 years. Do not use this product to treat cold symptoms in children younger than 6 years unless specifically directed by a doctor, and do not use it to make a child sleepy. These products do not cure or shorten the length of the common cold and may cause serious side effects, so it's crucial to carefully follow all dosage directions to decrease the risk for serious side effects. It's also important to avoid giving other cough and cold medications that might contain the same or similar ingredients, and to ask your doctor or pharmacist about other ways to relieve cough and cold symptoms, such as drinking enough fluids, using a humidifier, or saline nose drops/spray. When taking Sudogest Cold Allergy, it's important to follow the instructions from your doctor or on the product package. If you have any questions, be sure to ask your doctor or pharmacist for clarification. You can take this medication with food if it upsets your stomach, and be sure to drink plenty of fluids unless directed otherwise by your doctor. If you're using the liquid form, be sure to measure the dose carefully using a special measuring device/spoon. Don't use a household spoon and shake the bottle well before each dose if it's a suspension. For extended-release tablets or capsules, don't crush or chew them. Swallow them whole or as directed by your doctor. If you're using chewable tablets, make sure to chew thoroughly before swallowing. If your doctor has prescribed this medication for daily use, be sure to take it at the same time each day to get the most benefit from it. And if your condition lasts for more than 1 week, gets worse, or occurs with a persistent headache, fever, or rash, be sure to contact your doctor as these may be symptoms of a serious medical issue. Some common side effects of Sudogest Cold Allergy may include drowsiness, dizziness, dry mouth/nose/throat, headache, upset stomach, constipation, or trouble sleeping. If any of these effects persist or worsen, notify your doctor or pharmacist. If your doctor has prescribed this medication, they have determined that the benefits outweigh the potential side effects. Many people using this medication do not experience serious side effects. However, you should contact your doctor immediately if you experience any serious side effects such as mental/mood changes, ringing in the ears, difficulty urinating, or vision changes. Seek medical help right away if you experience very serious side effects like fast/irregular heartbeat or seizures. While a serious allergic reaction to this medication is rare, seek immediate medical help if you notice symptoms such as rash, swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so be sure to consult your doctor or pharmacist if you experience any other effects not listed here. As for the best time to take this medication, it is recommended to follow your doctor's instructions. Always take Sudogest Cold Allergy as directed and do not exceed the recommended dosage. Before taking Sudogest Cold Allergy, make sure to inform your doctor or pharmacist about any allergies you may have and any medical history, especially if you have breathing problems, diabetes, glaucoma, heart problems, high blood pressure, kidney problems, liver disease, seizures, stomach/intestinal problems, overactive thyroid, or difficulty urinating. This medication may cause dizziness or drowsiness, and alcohol or marijuana can make these effects worse. It is important to avoid driving or using machinery until you know how this medication affects you. It's also important to limit alcoholic beverages and talk to your doctor if you are using marijuana. If you are using liquid products, chewable tablets, or dissolving tablets/strips, be aware that they may contain sugar, aspartame, or alcohol. If you have diabetes, alcohol dependence, liver disease, phenylketonuria, or any other condition that requires you to limit or avoid these substances, consult your doctor or pharmacist before using this product. Before undergoing surgery, make sure to inform your doctor or dentist about all the medications you are using, including prescription drugs, non-prescription drugs, and herbal products. It's important to note that children may be more sensitive to the side effects of this product, especially excitation and agitation, while older adults may be more sensitive to dizziness, drowsiness, confusion, constipation, fast/irregular heartbeat, trouble sleeping, or urination problems. Dizziness, drowsiness, trouble sleeping, and confusion can increase the risk of falling. If you are pregnant, use Sudogest Cold and Allergy only if clearly needed and discuss the risks and benefits with your doctor. If you are breastfeeding, consult your doctor before using this medication as it may pass into breast milk and the effect on a nursing infant is unknown. It's important to be aware of potential drug interactions with Sudogest Cold and Allergy. Always keep a list of all the products you use and share it with your doctor and pharmacist. Avoid taking MAO inhibitors with this medication, as it can cause a serious and possibly fatal interaction. Also, be cautious if you are taking other products that cause drowsiness, such as opioid pain or cough relievers, alcohol, or other antihistamines. Check the labels on all your medicines, as they may contain ingredients that cause drowsiness. Additionally, this medication may interfere with certain medical tests, so be sure to inform your lab personnel and doctors that you are using Sudogest Cold and Allergy. If you or someone else has taken too much Sudogest Cold and Allergy and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call your local poison control center at 1-800-222-1222. Canadian residents can call a provincial poison control center. Symptoms of an overdose may include irregular heartbeat, hallucinations, fainting, and seizures. If your doctor has recommended Sudogest Cold and Allergy, it's important not to share it with others. Be sure to keep all medical and lab appointments while taking this medication. If you forget to take Sudogest Cold and Allergy at your usual time, take it as soon as you remember. If it's close to your next scheduled dose, just skip the missed dose and take the next one as usual. Don't take a double dose to make up for the missed one. It's important to stick to the recommended dosage schedule. When storing Sudogest Cold and Allergy, keep it at room temperature and away from light and moisture. Do not freeze the liquid form of this medication and make sure to store it out of reach of children and pets. It's important not to flush medications down the toilet or pour them into a drain unless instructed to do so. When the product is expired or no longer needed, be sure to properly discard it. You can consult your pharmacist or local waste disposal company for guidance on how to do this. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.